meeting for March 15th, 2022. We do not have a quorum today. We have in attendance myself, Councilmember Nash, Councilmember Roberts, and Councilmember Swope. Since we do not have a quorum today, we are not able to take any action on any of the bills on our agenda for today. However, we will at least hear any information or updates from the Department of Health, and followed by Commander Gilder with the Department of Safety.
Thank you, Madam Chairman. So, you talking about COVID particularly?
Yes, that'd be great.
So, we have, the good news is that our level of cases has reached the level at which we said in April of 2020 we could reopen the schools. So that's good. It continues to drop precipitously. We're moving toward, as I've told you guys before, we're moving towards endemicity. I know that the question comes up often about what about the testing stations, the vaccine stations, the strike teams, as they call them, that go out in small groups to different organizations, parties, birthday parties, whatever. I mean, they go to just about anywhere, churches. They will continue to do that. That may become a permanent fixture for flu shots, anything else. The stations, Chief, I'll defer to you. I'm not sure exactly what the plan is. I don't know how much longer they're going to go, but I know the staffing remains to be an issue for everybody.
Right, as everybody probably can imagine, getting staffing is always the issue. But Harry's just done such an excellent job of being able to maintain the staffing that they are. You think about how long they've been doing this. But toward the end of March, the last week of March, we will come together. Harry and the Office of Emergency Management, myself and the Health Department, will sit down and make an evaluation. Right now we have two assessment centers that are open, Murfreesboro Road and of course off of Charlotte. And more than likely what we may do is just condense it down to one. As you know, last time we done this, we sort of shrunk the footprint, and as soon as we done that, we had another variance that opened back up. So we're going to be very optimistic, of course, but methodical how we actually shrink the footprint. But according to the numbers right now, they look very favorable for us to be able to do that. We just want to allow school to, with spring break being in session right now, especially for metro schools, then we'll give a couple of weeks after that, and then we'll come together and make that evaluation, and then we'll report back. But we will have one station open, but right now the plan is to continue like we are. Toward the end of the month, we'll make a push to maybe shrink it down to one location. And more than likely, it may be the Murfreesboro Road site, because that's the ones that we actually control. The other one, we're just gracious enough to allow for them to allow us to use it. So we'll report back toward the end of March.
Question, are they still offering vaccinations at the centers?
Yes, absolutely. Vaccinations and testing. And we're still pushing. That's one of the things that, and I know we've said this until we're blue in the face, but basically with the testings going down, we're really trying to encourage individuals to get their vaccinations. They're able to do the toddlers up to adults. So again, we just keep encouraging everybody to come out and take advantage of a free, absolutely free. No, you don't have to set an appointment. Our hours of operation, we will, right now I think it's going to be from 7 to 1. Due to inclement weather, we do adjust that and change, because we got to take care of the men and women out there working, because they're out on that pavement. When it's super cold, it's always 20 to 15 degrees colder. If it's super hot, it's 20 to 15 degrees hotter. So Harry really is doing us a big justice, and I just want to take my hat off to them. So thank you.
Thank you.
And I would say, Madam Chairman, that as we understand it from the State Health Department, they intend to wrap up any extracurricular activities like that with reference to COVID at the end of the fiscal year, which is the end of June.
Okay. Has there been an increase in the percentage of vaccinated individuals in Davidson County?
Yes, it continues to creep up marginally, slowly, but we're, the last one I checked, we're in the high 60s now for the most most vulnerable populations, it's really high. It's in the 85, 90 range. I checked the last week at the combined the two centers. They were doing 120-ish tests a day and about 18-ish to 20 vaccines a day.
What's the latest on getting second boosters?
That's a good question. I'm not sure where they're still trying to figure out, I think, how long the third one lasts, or whether even if one is necessary at this point. It may be that it'll just become an annual shot like you do your flu shot, and they'll wait till that comes around. But that's a good question. I'm not really sure of the answer. Sorry.
Are there any other questions for health? Yes. Councilman.
Yeah, it's been, I think they found it on the West Coast already, 26,000 have been diagnosed in Hong Kong as of 2 days ago.
Yeah, that's always really happy news.
The Wraith coronavirus, as they're calling it now.
Yeah. So, and China's having another outbreak.
They've closed down 4 cities and I think 2 more today.
Yeah. And a lot of places that managed to skate by, mostly by closing up shop, have had Hong Kong is one of those places.
Yeah.
Korea has had another big outbreak. It's
Yeah.
just, it's,
So
you
is
know, it ain't
Taiwan.
gonna go away. And so the main hope is that whatever variant comes around, if it supplants the Omicron variant, it is just more contagious and not more dangerous.
Yeah, that's what I've heard too. I just wanted to hear you say it.
Yeah, that will always be the hope.
We added one, but we still need one more.
Yep.
Thank you for that report. Is there anything that you'd like to report, Commander Gilder?
Not unless you want me to speak on what our bill that's up tonight is about. I'm happy to cover that real quick if you want. Or no.
Unfortunately, we cannot.
The only other thing I've got is we had a public meeting that we announced last time we had public safety. It was on the 10th, I believe it was, with the displaying the new tasers. So folks were able to come out, see that, even do hands-on and test fire them. That was recorded and it should be available on YouTube, but it was also running on Channel 3 as well. So if you're interested in that and couldn't make it out, then that's available. So,
Great,
yep.
thank you. I neglected to say I'm Councilmember Jennifer Gamble, taking the place of our chair, Councilmember Evans. And again, we do not have a quorum, so we're not able to take up any action on any of the legislation on our agenda today. I will say that most, if not all of these bills and ordinance have gone through other committees, the Budget Committee, and so because of that, we will be able to discuss them and take them up on the floor, but we're not able to take any action in this Public Safety Health Committee. Yes, Councilman.
Motion to adjourn.
Motion to adjourn. Second?
Second.
Thank you.
For one moment,